Odomzo is a medication used to treat a specific type of skin cancer called basal cell carcinoma. It helps to control the growth of cancer cells and reduce the size of tumors. The usual dosage is 1 capsule taken orally once a day. It is important to take Odomzo at the same time each day, either with or without food. It is best to take it at a time that is convenient for you and easy to remember. Before you start taking Odomzo, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually once daily on an empty stomach, at least 1 hour before or 2 hours after a meal. Use this medication regularly to get the most benefit from it, and try to take it at the same time each day to help you remember. Do not increase your dose or use this drug more often or for longer than prescribed, as it will not improve your condition any faster and will increase your risk of side effects. If your condition does not get better or gets worse, make sure to inform your doctor. Side effects of Odomzo may include tiredness, abnormal taste, hair loss, headache, weight loss, nausea/vomiting, diarrhea, stomach/abdominal pain, mild itching, or decreased appetite. If any of these effects persist or worsen, inform your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefit to you outweighs the risk of side effects. Many people using this medication do not experience serious side effects. Contact your doctor immediately if you experience any serious side effects, such as muscle pain/tenderness/weakness/spasms, signs of kidney problems, or missed periods. While a severe allergic reaction to this drug is rare, seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed here, contact your doctor or pharmacist. In the U.S., call your doctor for medical advice about side effects or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects or report them to Health Canada at 1-866-234-2345. If you are pregnant or planning to become pregnant, it is important to know that Odomzo may cause serious harm to an unborn baby, and may even result in death. Therefore, women of childbearing age are required to take a pregnancy test before starting this medication. Additionally, it is crucial to use reliable forms of birth control while taking Odomzo and for 20 months after the last dose. For men taking Odomzo, it is not known if the medication passes into semen. To prevent any potential risk of passing the drug to a partner, including men who have had a vasectomy, it is important to use condoms during sex with women who are pregnant or of childbearing age, both during treatment with Odomzo and for 8 months after the last dose. Men should also refrain from donating sperm during this time. If you or your partner become pregnant or suspect pregnancy, it is essential to inform your doctor immediately. Before taking Odomzo, make sure to let your doctor know if you have any allergies. This medication may contain inactive ingredients that can cause allergic reactions. It's important to discuss your medical history with your doctor before using Odomzo. If you are planning on having surgery, it's important to inform your doctor about all the medications you are currently taking, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that you should not donate blood while taking Odomzo and for 20 months after stopping treatment in order to prevent your blood from being given to a pregnant woman. Older adults may be more sensitive to the side effects of Odomzo, so it's important to use this medication with caution. Additionally, Odomzo may affect normal bone growth and final height in children and young adults. It's essential to discuss this with your doctor before starting treatment. This medication is not recommended for use during pregnancy as it may harm an unborn baby. It's crucial to discuss the use of reliable forms of birth control with your doctor. It's also important to consult your doctor before breastfeeding while using Odomzo and for 20 months after your last dose of the medication. It's important to be aware of potential drug interactions with Odomzo. Other medications may affect how Odomzo works in your body, and this could impact its effectiveness. For example, certain antifungal medications, HIV protease inhibitors, drugs used to treat seizures, and St. John's wort are known to interact with Odomzo. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. If someone has taken too much Odomzo and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call the local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It is important not to share this medication with anyone else. Before starting Odomzo, it is necessary to undergo certain lab and medical tests, such as a pregnancy test, kidney/liver function, creatine kinase levels, complete blood count, and blood glucose. These tests should also be continued while taking Odomzo. It is crucial to attend all scheduled medical and lab appointments. Make sure to consult your doctor for more information and specific details regarding these tests. If you forget to take a dose, just wait until your next scheduled dose. Don't take double the amount to make up for the missed dose. It's important to store Odomzo at room temperature, away from light and moisture. Remember not to keep it in the bathroom, and always keep it out of reach of children and pets. When it comes to getting rid of Odomzo, don't flush it down the toilet or pour it into a drain unless instructed to do so. Instead, make sure to properly discard it when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this responsibly. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.